Today we have very interesting, boring topic for discussion. COVID-19 challenges in surrogacy overseas. We all know that this problem is very vital for many couples who now entered surrogacy process or in the middle of surrogacy process or very close to delivery of their children. At the moment, we want to share our experience, what to do, how to manage surrogacy process under quarantine conditions, how can we help our patients, our customers during this hard time, and we want to light up the options, and maybe that will be helpful for you to understand more clearly your further steps. If you want to cross the border, if you want to reach your child earlier than quarantine will end, because actually we have no clear understanding when it will happen. I want to introduce our speakers today. That will be me. My name is Nadiia Melenevska. I am a head of international department at IVMED clinic, and me as a director of IVMED Family Agency. The second speaker is Olha Chaplia. She's a senior embryologist at Medical Center IVMED, and she is senior specialist. Her professional field of skills, embryology, fertilization, the management of laboratory. So if you have questions regarding how we arrange how we arrange our laboratory services, you can ask her during quarantine. You can ask her also these questions. And we have invited speaker, experienced lawyer, attorney at law, Olha Danchenko. Olga helped many couples to in exit process during surrogate programs. She has experience, and she can share today with us her knowledge how to cross the border, which steps you should follow during the recommendations of Ministry of Foreign Affairs of Ukraine, how you can contact your local authorities to push your process, paper process, permissions process. And so we hope that will be very helpful for you during this time. So if we talk about the problems in surrogacy process at the moment, we all understand that we faced the next issues: closing the borders. We have pregnant surrogates in programs, and the most problem is lockdown in transport and intercity transport, public and intercity transport between Kiev, for example, and other cities. And now I will light up how this process can be arranged remotely, what we can do in this case. And also big problem related to already born children, parents who cannot reach these children because they have to obtain some special permissions, and it is not always easy to understand how to get these permissions. So if talk about what you can do, if you want to have clear understanding of what to do, you should keep in mind 4 essential issues. First one, this is the permission for exemption. Not all countries, but some countries, they not only have closed borders with Ukraine, they even cannot leave their countries without permission. So in this case, they can turn to immigration offices that should help them to obtain this permission for exemption. The second is permission for entrance to Ukraine. The only authority that can issue such permission, this is Ministry of Foreign Affairs of Ukraine. How to communicate with this ministry? Olha Danchenko will tell you more exactly the details. In general, I can tell you that you should do it only through your representatives, or your embassy or consulate in Ukraine. This diplomatic way to contact Ministry of Foreign Affairs is the only way to push your matter and just to make it working. The third problem is flights connection lockdown. So, okay, you can get permissions, but how you will get to Ukraine? This is the third and maybe not easiest problem. I will tell in a minute what you can do, but the fourth issue here is observation under quarantine for 14 days. Again, this is maybe an unpleasant point, but at the moment, Ukrainian government issued, and as many other countries, prescription that foreigners who cross the border of Ukraine, they should stay under obligatory quarantine. And this quarantine is for 14 days. What does it mean, obligatory quarantine? It means that you should stay in definite place defined by Ukrainian government. It can be a hotel, it can be some special facility. Here is some information that we've got during this week, thanks to Olha Danchenko, that there are a few options, maybe more effective. Special charters. We advise parents to get together, be active, and you can turn to authorities like Ministry, again, through your consulate, to Ministry of Foreign Affairs. They always have information about the flights because they, at the moment, busy with transporting people, our Ukrainian citizens, back home to Ukraine. So they arrange special flights with connections through different countries who have open borders, and you can join these flights and get to last, I can take for us chance, Belarus. Belarus, and then you have a few ways how to get from Belarus to Ukraine. Or if you have, there can be charter not through Belarus, it can be through other country. But if you will decide to go through Belarus, you can again fly by plane, or you can go by car and cross the border. At the moment, there is restriction that you can cross the border only by car if you choose road. And at the moment we have information that if you cross the border using plane, you fly to Borispol airport in Kiev. And if you fly to Borispol airport in Kiev, you have to stay in obligatory observation for 14 days. Again, there are some difficulties even with taking to these observation places. It should be done using special transport, which should be arranged in advance. It cannot be private transport. And if you cross the border by car through Belarus, again, you will need, it depends on country and relations between diplomatic relations between countries. Maybe you will need transit visa, or maybe not. But again, if you travel by car, you have restrictions in Belarus not to stay mostly in your car. Even if you will have places for rest, you cannot leave these places for rest. And again, due to quarantine. And then when you will cross the border with Ukraine, why you need this permission from Ukrainian Ministry of Foreign Affairs? They should notify the border service that you cross the border within 48 hours, and then you will be allowed to cross it. After border, so at the moment we have information about self-isolation, so you can have some reserved booked place for you where you will stay, and notify the border service about this place. But this information may be even out of date, and you should check every day. It can be obligatory observation even when you cross the border by car. And places for these observations again can be defined. So I will back to our field about how we arrange surrogacy process during quarantine. And I can explain you how we in medical center IVMED and IVMED Family arrange monitorings, because it is very important. So if there is a term of pregnancy less than 26 weeks, we have to monitor at the moment remotely surrogate mothers. They should visit local hospitals and make their analysis, and they should go through ultrasound checkups. Obligatory, they send us and we exchange information about the state of health of surrogate mother. They send us reports about pregnancy development, and we always in touch with surrogate. She should every morning notify our coordinator, senior coordinator for surrogates, regarding their state of health, body temperature, whether they have some new symptoms or something suspicious. When we have, usually in IVMED, we practice in moving of surrogates to Kiev not later than 26 weeks of pregnancy, Actually, it was done because of high risk of premature delivery due to IVF pregnancy. IVF pregnancy is not the same as natural pregnancy. It is always with hormonal maintenance and needs to be monitored very carefully, and we have to provide the surrogate mother the best medical services in case of emergency. At the moment, again, we understand that our strategy always works correct, because at the moment it is very hard to reach surrogates on term until 32 weeks, far from, for example, Kiev, and hard to provide them with assistance. So if it is possible for you to transport your surrogate mother earlier to Kiev, we strongly advise you to do that under these current time conditions. If we talk about the new surrogacy programs, at the moment mostly of them postponed because again, this we have recommendations from European Society for Human Reproduction and Embryology. They recommend to postpone planned treatment. It means that embryo transfers will not be done during quarantine period or under some special conditions. So the main issue that we faced with already born children, it is how to arrange the medical care for them, because they will stay after birth without parents. That parents and surrogate mother, we consider it is not good idea to leave the child with surrogate mother due to some psychological issues that can appear during this stay. I think we all understand what I'm talking about. And how we arrange and how we advise to arrange the medical care and general care for those children. We advise just sorry, a little bit forward. So first of all, we need the power of attorney issued to person who will care about the children. In our medical center, in our IVMED Family Agency, we are responsible for these children, and we need the power of attorney, which will empower us to sign some documents on behalf of parents' names. We will be in charge to manage some process regarding children, legal registration, and so on. We advise to, okay, you have, there is no restrictions. You can take child to rented apartment. You can hire a nurse or a nanny for child, but we advise to use those hospitals, maybe maternal hospitals, that can provide professional medical care and general care for children, because these children should be monitored. It is very important. You should understand there is not other children, that is your children, and we just hold very, very, very big responsibility for that. So everything should be done due to protocols. Child care especially should be done due to protocols. So hospitals will provide less risk of infection. If you will arrange the babysitter, you should control how often this person will leave the apartment. Due to these quarantine conditions, the exchange of infection should be completely eliminated, as you understand. And obligatory, regularly arranged pediatrician consultations, that should be done in any case. So pediatrician should visit your child, should control the state, should control the feeding. So any other requirements should be fulfilled. For surrogate mothers, we have coordinators for surrogate mothers who completely support surrogates during these hard times. 24/7 hours they are in touch in them. They can call, surrogates can call to coordinator anytime. They can ask advice, recommendation, notify regarding the changes in their state. As we know at the moment that pregnant women, they are in a risk of group risk regarding COVID-19, and the general recommendations that we also give to them, it is these 4 essential points, like stay home, keep social distancing, wear mask, wash hands. We all understand that the only way is in these points to trust to your surrogate mother that she follows all these instructions. If she follows all these instructions, she will be safe. That is for sure. Then again, we recommend them to control daily body temperature, because due to described COVID-19 symptoms, it can be very low, even unnoticeable. So they control that and announce to medical coordinator. And I want to I want to finish my part with this question. Can I trust my baby care to my agency in my absence? I want just to tell you a few things that we always explain to patients when they only enter our clinic, when they do first inquiries to us about programs. We explain them. It is very important to choose professional agencies, to check whether your agencies really exists, registered, which responsibility they can bear. Are they enough professional to understand how to act in urgent situations, in extreme situations? Which contacts do they have? How they will act under these emergency situations. That is why we always advise them to check up all these points, because remember, please remember, these people, the only who will live in Ukraine after your when you will departure from Ukraine, signing contracts, and these people will care about your children and how they will arrange your process. You will be completely dependent on them. We want to ensure our parents and our programs that your children will be cared completely, carefully. All the best medical specialists will provide the highest level of support, professional medical recommendations. We will follow all these recommendations, so you can stay, you can have peace in mind that everything will be done due to the highest standards. Medical Center, IVMED, and IVMED Family Agency. And I want to give some words to Olha Chaplia, our embryologist, who can, in a few words, just describe how we, at the moment, arrange the maintaining of embryological lab during current time. Olga, please, can you just say a few words about that?
Hello. What can we say about maintaining any embryologic procedure in IVF lab? Basically, there are a lot of sexually transmitted diseases, including viruses and bacterial one, that we have been knowing for decades. And a lot of procedures are, from the very beginning, arranged so we are minimizing the chances to spread any infectious agents. Moreover, when you work at the laboratory of IVF field, you have to take into consideration two important sets of rules. The first one is about maintaining sterility in the laboratory, and the second one is about to avoid any possibility of patient's material mixing. And if IVF laboratory is able to successfully combine these three sets of rules, what IVMED IVF lab does successfully for years, this helps you to be sure that you guarantee the minimizing of SARS-CoV-2 spread in the laboratory. But to say briefly what we actually do. Firstly, we treat any biologic material as a potentially infectious one. It means that we are using only one-time disposable materials, including dishes, pipettes, needles, anything in the laboratory. With the biologic material, we always work in sterile conditions with the help of so-called laminar flow. It means that a special device, laminar flow cabinet, creates a very clean, purified airflow. And in this airflow, on our working stage, we are working with embryos and oocytes. And if we are not working under laminar flow, we perform any procedures like ICSI or biopsy under the layer of oil. So the drops of culture media where embryos are kept is covered with oil, and this oil works as a special shutter. If any particle falls into the dish, it stays on the surface of the oil and doesn't go inside the drop. Of course, if we talk about, I already saw the question and I will a bit touch the answer. If you say about maintaining the cleanness of the laboratory, we also should understand that personnel also can be the source of any virus or dust particle. That's why we have a very strict system of entrance in our IVF lab. No one except embryologists are allowed to come. Even doctors are not allowed to. When embryologist enters the laboratory, he or she puts on special medical gown, hat, face mask, changes shoes, and works with the gloves. And of course, we thoroughly and regularly disinfect all the surfaces and important parts of our devices, like incubators where we culture embryos, with the special solutions, for example, FertiSafe or OSafe. They are not based on alcohol, but they still are safe for the embryos and totally detrimental for any kind of virus, fungi, or bacterial agents. So to sum up, we try to do maximum in order to, from one side, exclude any possibility of virus spreading, and from the other side, to maintain a high result chances for our patients. Thank you.
Thank you very much, Olga. And we will move to Olha Danchenko presentation. And welcome, Olga.
Welcome our dear guests. I'm trying to upload my presentation, just a second. Can you see it?
Yes, you can.
Oh, wonderful. Thank you very much, Nadiia, for introduction. It was very interesting to hear all this information which I've got now. Really appreciate all efforts which are done by IVMED and IVMED Family. And I'll focus on legal aspects of effect of COVID-19 on surrogacy process, especially for intended parents who come from abroad, because really COVID brought a lot of mess in our routine life, and it massively affected all sides of surrogacy process too. Nadiia already touched upon the very burning issue, and we receive nowadays a lot of inquiries. So how to get for intended parents to Ukraine, especially intended parents whose births are due in the very next time, or even worse, whose baby are already born and stay without parents' care. On this slide, you see this formal wording of Audience of Cabinet of Ministers of Ukraine, which says that the state border for foreigners is banned. But we have a sentence that gives us a loop to try to still to get permission to enter Ukraine. So entry into Ukraine by other categories of foreigners is carried out by agreement of the Ministry for Foreign Affairs of Ukraine. And it gives us a basis to take this proactive position and to work for entry permission to Ukraine. And however, we have checked a lot of times directly with head of consular section of Ministry for Foreign Affairs, and it is so that Ukrainian MFA can be approached only through relevant either Ministry for Foreign Affairs of the country whose citizenship the intended parents have, or their diplomatic mission in Ukraine, so the embassy or consulate. And of course, we understand that a lot in this process depends on the will of each concrete embassy of each separate country to be cooperative and friendly to the intended parents and to help them. So now we have worked out several groups of intended parents from particular countries and try to broaden them, because some embassies, they are very active, they really help, and we have received already parents with these travel permissions to Ukraine, but some embassies still reject to cooperate and to send official diplomatic notes to Ukrainian MFA. Of course, MFA will not give, unfortunately, entry permission for all intended parents. So what they need? The basis for application is, of course, plead to best interest of the baby, because we have article of Convention of the Rights of the Child of United Nations Convention, and it said that the child shall be registered immediately after birth and shall have the right from the birth to the name, the right to acquire nationality, and as far as possible, the right to know and to be cared by his or her parents. So we should act in the very best interest of the baby to be cared by the parents. And this being said, so the prerequisites to apply with the diplomatic note for the embassy of each separate country is a medical certificate. So they should understand and prove the urgency of the travel need. So fertility clinic should provide a medical certificate confirming pregnancy via surrogacy and the anticipated date of delivery, or even if delivery already took place, the date of baby birth. There is no standard form for this document, so it can be just like a part of a certificate on genetic link, or something from the clinic may be added. So it should continue basic information, passport details of the intended parent, surrogate mother, and of course to prove urgency of travel need. As Nadiia already set out, so the intended parents should work out travel route to Ukraine and even entry point, because MFA is really a puzzle, but it works like this. So the MFA will give travel permission only if they know that trip is really needed for urgent reasons, and if they know how the intended parents get there. So they should either book flight tickets or tell exactly which checkpoint of Ukrainian border they will cross, and even the type of the car, all possible details and the exact date. And this travel permission will be valid only for this certain period of time and a certain checkpoint of Ukrainian border. And also it was notified by Nadiia that citizens of the countries which have visa regime with Ukraine should have valid visa or even transit visas through other countries like Belarus. About quarantine, also a lot of things were said, but it is really so that we have this decree. These days we have actually a lot of decrees of the Cabinet of Ministers of Ukraine. Sometimes they are really, even for us lawyers, difficult to read because they are long and sometimes controversial, and sometimes they do not include even a mechanism, how to implement it in real life. So it's brainstorm for everybody, and we also learn these lessons and have to learn quickly because there are no regulation how to act in COVID-19. So nobody knows exactly, but of course we shall try to do our best. And it is really so that hospitalization in these observatories or isolators is mandatory for all persons who are crossing the state border of Ukraine, either by plane or by car, if we look at this decree. But this mandatory observation, it should be organized by local administrations of Kiev city and regional administrations. And not all administrations, especially of the regions who have these crossing border checkpoints, have now this regulation for observation. So it's something that really should be checked before the very trip. And as for travel out of Ukraine for foreigners who were lucky enough to get to Ukraine before COVID and to get travel documents for the children, so here we have to say the situation is much easier. Travel out of Ukraine is not restricted at all. However, again, there are no regular flights, and some checkpoints for car crossing of the border are closed. So highly advisable to check the route according to current information provided by State Border Service. And foreigners, of course, have to approach embassy of their country and inform about intention and aim of travel, because free travel is not allowed now. Another set of questions is, of course, birth registration in Ukrainian vital statistics, because everybody knows that before this situation, providing birth registration for the babies born through surrogacy in Ukraine was very strict, and it was not possible without physical presence of both intended parents in Ukrainian vital statistics. So only for exceptional health reasons, I have seen in my life only several cases where vital statistics has agreed to registration in absence of the parents. However, now in these exceptional circumstances of coronavirus development, there is a possibility to conduct birth registration by duly authorized representative of the intended parents. But of course, we should understand that surrogacy program was performed strictly in accordance with requirements of Ukrainian law, and full package documents is submitted, because in such a case, vital statistics will obviously check the package of documents thoroughly. So they would need some additional paperwork, like a contract with the surrogate, for example, and they will obligatory check if the couple crossed Ukrainian border for the beginning of the program, or how they arranged it, if through the powers of attorney. So we have to show these powers of attorney initial, and all medical paperwork, contract with the clinic, consent forms, and so on. But nevertheless, birth registration in absence even of both parents became possible these days. Which are critical points to this positive moment? First, the intended parents can issue power of attorney and application for birth only after delivery. We have also received a lot of questions if we can do in advance, if we can prepare some drafts and sign or insert in writing or whatever. Unfortunately, no, because if we look at this form, standard form of typical Ukrainian wording, application for birth registration, it should include birth date, which of course can predict in advance, and details of medical birth certificate issued by maternity hospital. So we can only start preparation of drafts on the date of delivery. Additionally, this powers of attorney, so I say powers because from each parent, and applications, they should be notarized and legalized. And we do not know how it is at the moment with these steps in country where the intended parents live, because I see that in some countries notaries do not operate. And the last electronic form would not be sufficient for vital statistics, so it's maybe only used for beginning of translations and preliminary submission to vital statistics for them to check out. But final birth registration can be done only when we have originals, and they should be sent to Ukraine by courier mail. So what I wanted to show with this watch is that it all takes time, unfortunately. Other administrative services provided by vital statistics and other bodies of justice, except for birth and death registration, are not performed now until the end of quarantine. So it means we do not have app still. And however, notaries, they proceed mostly. Some stop their work, but there are notaries who can continue and provide notary certification by prior appointment, of course. And of course, the intended parents will ask, how about the work of diplomatic missions in Ukraine? If they come here or manage to get birth certificate and to put together all the rest package of documents for surrogacy exit process, if the embassy will accept it. Again, it is very, very individual. There is no unified answer for everybody now. Because as we see from screenshots of websites of different embassies, they stopped their routine work, routine services, but they can receive intended parents in cases of emergency. So we think that surrogacy exit process is a case of emergency. So we are sure that they will proceed on reviewing documentation and processing on passport application. But as for package of documents, to the best of my knowledge, lawyers of different countries try to work out ways to make it easier. For example, we know that the Swedish lawyers work for the intended parents to make it possible to get a passport without DNA test, but just on the basis of certificate on genetic link from fertility clinic. But passport hasn't been issued so far, so I cannot say that it was successful. But at least there are some efforts also from local lawyers from countries where the intended parents come from. Yes, as you see, apostille is not possible, so embassies who require a package of documents with apostille will obviously not get it nowadays. If some package of documents is needed from surrogate mother, it may also be a problem. For example, if the embassy would need her birth certificate, as some countries need, or her documentation on marital status, like divorce decree or something like that, so she will not be able to get it. So in the post-surrogacy exit process, we have to work individually, case by case, collect the package, what can be done, and negotiate with the embassy. That is the only recommendation that can be given now, because there is no definite answer if it's possible to make it easier or not. And the only positive thing which I found out in all this COVID mess, like I wrote, is a cancellation for lockdown period of foreigners in Ukraine. We also get a lot of inquiries because people have to stay, the intended parents have to stay here longer. And then it's permitted by our law, even for countries with visa-free regime, they cannot stay here more than 90 days. So for this category of foreigners who overstay in Ukraine, there is no penalty for the whole period of quarantine in even 30 days after. So they can apply to the units of Department of Immigration Service of Ukraine even within 30 days after quarantine is over. So at least people who are stuck here or locked down with their children and try to put together documentation, they do not have to worry about their legal status in Ukraine. That is what I wanted to say briefly about the legal situation, and would like to wish everybody keep safe. Of course, stay healthy. Cannot say stay home because some intended parents definitely want to be here with us with their children. Just let's say stay healthy. Thank you very much for your kind attention.
Thank you very much. And I would like to add also some information regarding to share experience contacting some consulates and embassies. I can tell that making conclusion from all these contacts, your things will be easier if your consulate will assist you, if they will make step towards you, because actually it is not a big problem to get permission to enter Ukraine. Everything depends on the readiness of your site and your country to help you to forward your personal data and your application to Ministry of Foreign Affairs of Ukraine. At the moment, such countries like USA, Australia, Britain, Olga may correct me. Mm-hmm. Yes, they help their citizens to get permission, and these couples, they can, and success Irish couple yesterday entered Ukraine, and those countries which don't want to be involved in this process, the consulates that refuse people to help in communication with Ministry of Foreign Affairs, which reacts within 15 minutes actually. Those couples, they cannot reach their children, and unfortunately we cannot influence on this process. Our position is very active. We try to push these consulates, we make applications, we send them requests, call, ask, whatever we can do, we do, because when we analyze, for example, such countries, heavy countries like China, Argentina, they say that we don't know how to do this note to this application to Ministry of Foreign Affairs. We don't want even to know how to do this. And we try to send them all instructions step by step, telling them that there are people who can enter from other countries, and you do nothing to help these people. So we actively push, and we will proceed to do that. And we understand that joining other parents who also in the same situation will help you profoundly, because it is more easier to get to the charters. It is easier to push consulates when you do it together. And this, for example, Chinese embassy told us, nobody, you're just one who did request for us, and no other parents don't want to push their things. So as we understand, there should be a more active position from parents yes, to move forward. We have questions. We are happy to answer them. There is the question, first was from Anne, whether this webinar will be recorded. Sure, this webinar will be recorded and will be issued to YouTube channel of IVMED Medical Center. You can find it. You can write to us. We will send you a link if you can find it easy. The question, let's say in July the restrictions will be gone at least till November, and you can have an IVF procedure, and we can have an IVF procedure. What are your measures to prevent an eventual infection with SARS-CoV-2 inside medical center and with personnel? We can tell you, and as Olga Chaplia told previously, there are a number of measures that, again, separately will be implemented by medical part, doctors at IVMED, and another part in laboratory. She can maybe in short tell again how, but from medical point, there are some special prescription from Ministry of Health of Ukraine, which defines the order how the sanitary regime should be implemented in medical facilities. And these prescriptions include the usage of, again, masks, sanitizers, social distancing. Then we are planning to implement testing. We will test our workers, our staff. We will check whether they are healthy, don't have this RNA virus, and then they can work, they can enter the facilities. Let's say we will follow all official recommendations, and we will invent our own, so we can ensure you that that will work for everybody, for staff and for visitors. And we have another question. So the chat. Hello, thank you for your presentation. I have a question to lawyer. We are planning to take part in surrogacy, but my husband has difficulties with holidays. We are from Argentina. Can one of the parents prepare documents for the child and return home with the baby, or both parents should be in Ukraine during exit process? Olga, this is for you question.
Thank you for the question. So it will depend on the situation. If you're only planning, yes, Nadiia, they only
yes, planning holiday.
So typically both intended parents need to be for birth registration. The only exception is COVID, what we are undergoing now when there are no flights and almost total ban for foreigners to come to Ukraine. Only in such circumstances, or second exception, it could be a health condition which doesn't allow to travel. So only holidays would not provide any exception for him. So at least for birth registration, he should be present in Ukraine. So as I see it now, difficult to say how it will be at the end of the program, but now the legislation is like this.
Thank you. And another question to you. Sorry. Hi, we have already appointed a representative in Ukraine with power of attorney. Should we appoint another?
We do not understand who.
Yeah, maybe if you can. So if Ivan, if you can just provide more details about in your question, because I can read again. So as I understand,
they are not satisfied with their present representative. If so, there is a right to revoke the power of attorney anyway, but they have to advise their present representative accordingly, so that he doesn't take any actions, and they are free. They have absolutely right to take another representative.
Thank you. And the question to embryologist. Is there a risk of infection of biomaterial with the COVID-19 virus?
Well, I would say that's quite a good news, because according to nowadays our knowledge, we can state that human spermatozoa, oocytes, and embryos, they lack ACE2. This is a specific receptor that SARS-CoV-2 is able to bind. That means that this new virus is not able to connect, to enter, and to infect human embryos. Moreover, it should be stated that any oocyte is surrounded by a special shelter. It's called zona pellucida. It's a very thick structure, and also it can be an additional barrier that can prevent virus from entering oocyte. But actually, it's not able to enter anyway, because in order to interact with any biologic object, virus should connect to a specific receptor, and embryos doesn't have it. And as the third moment that I haven't mentioned yet, and during any IVF procedure, we have a lot of steps of so-called washing. Before you put the oocyte from one dish to other dish, you wash it. You do the same for plenty of times. During any procedure, denudation, ICSI, dish change, biopsy, freezing, thawing, any procedure is followed by the numerous washing steps. And it was even counted by one embryologist that during procedure of freezing and thawing of embryos, the media that surrounds the initial embryo is diluted by 6.6 trillion times. It means that even if virus was in the initial drop, its concentration becomes so low that it's totally not able not only to infect embryo, but to infect human being. So as to our knowledge nowadays, no, SARS-CoV-2 is not able to infect any biologic object in IVF laboratory, except embryologists, to be honest.
Thank you. And there is again a question to lawyer. We are planning to take, sorry, not this. How to avoid disclosure of information that a child was born in a surrogate program if the court in our country requires a detailed certificate from the registry office in Ukraine?
Difficult to say what is detailed certificate, because we have standard birth certificate which has information only on the intended parents, and you know that according to Ukrainian law, only intended parents are deemed to be legal parents of the baby born via surrogacy, and the information on the surrogate is contained only in remarks of vital statistics register, which is strictly confidential, and it cannot be shown even to the court. Only some criminal procedure should be done to disclose this information. So if you are asking about full extract from birth register, of course it will have a small line about the basis of birth registration, part 2, article 1 to 3. And there is no way to avoid it. But we can discuss this case individually for what reasons the court is taking place and what kind of evidence they need. As for this, how was it formulated? What kind of document is court requesting?
So many questions that I lost this one. Just a moment. Court, again, I will read again. How to avoid disclosure of information that a child was born in a surrogate program if the court in our country requests a detailed certificate from the registry office in Ukraine.
So I would try to negotiate with the court what kind of detailed certificate they need, because we have only one certificate. If it's not an extract, all will be fine. So no birth certificate will disclose name of the surrogate.
Okay, thank you. And now the question to you, surrogacy is legal in Ukraine, but, sorry, that is the same, that's the same, maybe mixture. And as I can see, another question, maybe it is for me. What is the process of pregnancy care in normal times? How often does the surrogate visit a doctor? How often does she undergo planned ultrasound examinations and blood tests? Thank you for the answer. I think it is a very good idea to arrange a next webinar with our doctors who will explain more about the process of monitoring of surrogates and surrogacy programs. What I can say at the moment that there is a protocol of monitoring pregnancies. We started from the pregnancy test. Actually, the pregnant woman should be registered in a hospital starting for pregnancy monitoring, starting from 12th week of pregnancy. We do but we monitor even this very, okay, let's say short but very important term between pregnancy test and 12th week, because very crucial moments and very important processes of development are being registered during this period, and only very experienced and professional with exact knowledge may do this monitoring and make conclusions. Because as to my experience with working with some agencies, they sometimes do pregnancy test in our clinic, and then they leave clinic for their own monitoring somewhere else in some local clinics close to surrogates living accommodation. And there is no such specific fertility specialist who can really monitor correctly these early terms of pregnancy, and they do that like in a case or just or even do not even perform these monitorings until 12th week, and then can come for these fertility clinics and do general ultrasound screenings and so on and so on. But it's very important to have pregnancy care program exactly at medical center that specifically practices fertility technologies, because we know about hormonal maintaining everything, which obviously is not clear for any other specialist in general practices. So yes, surrogate, they pass through 2 big screenings during 12th week, and then 18th-19th week, the big screenings regarding development of the child, the prediction whether there is a risk of some chromosomal abnormalities, and so on. But between these big monitorings, of course, there are periodical visits to doctors for all analysis, for all checkups, and infection testings, which is also important point, because some even infections that surrogate mother can catch during the pregnancy can be treated and should be treated, and not to avoid unpleasant surprises after delivery when you have problem in child, not only in surrogate. So it is very important to do everything in advance and avoid all these problems. So we should finish our webinar. Thank you for, I want to say thank you to our speakers. You provided us with very interesting information. I think it is very brand new and will be interesting for our customers. And I want to again invite you for the next webinars with IVMED. And if you have questions, please contact us. We have mail contact at IVMED.com.ua. If you have questions that I did not read at this time, so we will send you an answer, written answer, anytime. Thank you very much, and really keep safe and keep healthy. Bye bye.
Orthodox Easter for my colleagues. Bye.
Bye.